Sciatica or sciatic nerve pain. It sucks. The numbness, the burning, the tingling. It can be hard to sit, hard to sleep, sometimes hard to stand and walk depending on the cause. If you're going through it, if you've been through it, all you're really looking for is a break from the pain, a little bit of relief. Well, that's what this video is about. Hi, I'm Dr. Scott McCrimmon, a chiropractor here with Caledon East Family Chiropractic. In this video, I'm going to go over some of the exercises that we give to our patients to help give them some quick relief from their sciatic symptoms, and then talk about things that can be done in the long run to hopefully help prevent this pain from coming back. So as you probably know by now, if you're going through any type of sciatic issue, that nerve starts in your lower back, it goes through the muscles in our glutes and our rear end, down the back of our leg, and then reaches all the way down through our lower leg, into our foot, and depending on which nerve root, into our toes as well. Now, there are different causes of sciatica, so knowing the cause can be really helpful. So hopefully you've had it checked out by somebody, but if you don't know the cause, we're still going to guide you through some exercises and help you make decisions as to what exercises are best for you. The two biggest causes of sciatica that I see in my office are either degenerative stuff, so wear and tear, arthritic, degenerative discs in our spine, often lead to something called stenosis, or a narrowing around the nerves, or from a bulging or herniated disc. Those are two most common, and if you have sciatica, there's a pretty good chance that one of those two is the main cause. They have some similarities, but they also have some differences. Regardless of the cause of your sciatic pain, that pain going down your leg, there's one principle that we go by, and that's something called centralization, meaning we want that pain to work from our leg and gradually work its way up towards our glutes and back into our lower back. So as a simple rule of thumb, when you're going through any exercise for sciatica, if it takes pain out of your leg, that's a good thing to keep doing. If it's making the pain worse down your leg, then we want to pause and reevaluate what we're doing, because that's usually not a good sign. So keep that in mind as you're going through this video, through these exercises or any other exercises or positions that you try. If the pain's worse down your leg, probably a good idea to stop and get it checked out. If the pain's coming out of your leg, that's a really good sign that you're on the right track. So the first thing that I like to do in any type of exercise routine for sciatica is to slowly loosen up some of the tissues. There's a couple different ways that we can do some stretching to get things loosened up. Usually the glutes. The glutes is where, and the hamstrings, where people are the tightest. So I'll show you a couple simple stretches that you can do to work it in. So while sitting, if you're tolerable sitting, for example, if it's a disc, sitting is usually really uncomfortable. If it is a comfortable position for you, you can easily just cross one knee, one foot to your opposite knee, and just pull your knee towards your opposite shoulder, and you'll feel a nice stretch in the back. For a lot of you, the sitting might be quite uncomfortable, so you can easily do this lying down. So what we have you do is just lay flat on your back with your knees bent, take the affected leg, and what I like to do is, number one, pull your knee straight to your shoulder. That will open up the lower back and often feels quite nice and relieving. Then you can continue and put your foot on the opposite knee and then pull your knee again to your opposite shoulder. You should feel a really nice stretch through your glutes in here, and because that sciatic nerve travels through those muscles, the tighter they are, the worse the sciatic pain often is. I like to hold this stretch for a good 20-30 seconds and then give it a break, and then we do it again. So again, I'll do 20-30 seconds this way, and then 20-30 seconds across. A gentle, comfortable hold. Again, looking for a nice stretching feeling, but nothing that's making that pain worse going down our leg. Another exercise that I find helpful in warming the tissues up around our lower back is something called the cat camel. So you can do this on your bed or on the floor. And what we do is we get into an all fours position, and all you're going to do is slowly round your back up, almost like a pelvic tilt, and then a reverse pelvic tilt, or extend your back. Work within pain-free ranges, just about 5 to 10 repetitions, nice and slow and controlled, just to get things moving in there. Again, feel for the pain, feel for any discomfort, and work within pain-free ranges. This is not a no pain, no gain situation. You're not trying to push to extremes. You're just trying to loosen up tissues so when we do the other exercises, they're going to be more amenable. So start with stretching the glutes and the hamstrings by pulling your knees up towards your chest and across, and a few repetitions of cat and camel, again, within what you can tolerate to get everything started. Okay, now that we've got some of the tissues around that nerve hopefully loosened up a little bit, now we want to start to mobilize the actual sciatic nerve itself. So something to remember with the sciatic nerve, or any nerve for that matter, nerves do not like to be stretched. So when we think of stretching, think of a rope, you grab both ends and you pull them apart. That's putting a stretch through that rope. Nerves don't like that, especially an irritated nerve, whether it be disc or degenerative causes. But what nerves do respond well to is a gliding, or what we call a flossing. So if you think of flossing, you take a rope or a piece of dental floss and you slide it back and forth or glide it back and forth. That actually can help free up the nerve and take some of the irritation off of the nerve. So when we think about sciatica, the way you stretch the sciatic nerve is you put one leg straight out when you're sitting, especially if it's disc caused, point your toes towards you and put your head down. That's what I don't want you to do, because that's taking the nerve and doing this. Okay, so I'm going to show you a few ways to glide it. We're going to start the easiest way, work up to some more challenging ways. Depending on what level of injury and healing you're at, you can find the one that works best for you. So the first one we start to mobilize or glide the sciatic nerve, easiest way is just to lay on your back on your bed or on the floor if you're comfortable. Reach behind the affected knee, bring it up to about 90 degrees or maybe a little bit past. And all you want to do is slowly straighten your leg as much as you comfortably can. You should start to feel a stretch here through your hamstring. If you're getting sciatic nerve pain, then just go to just where it's about to start, and that's as far as you need to go. So in acute cases, you might only be getting to here. If you're somebody who's a little further along or doing a little better, you might be able to get your leg almost to vertical. Okay? So all you're going to do is from here, we're going to go up, count to about 3, 4, 5 seconds, bring it back down. Again, up, 1, 2, 3, and down. Okay, you're going to do about 10 to 12 repetitions of that. If that is easy for you, that doesn't create any trouble, then you can add another layer to this exercise. What you do is you're going to bring your leg up until you feel that nice hamstring stretch, and then you're going to move your foot. So you're going to point your toes down towards you. 1, 2, 3, point them away from you. Pull them down, point them away. Okay, so this is, again, taking that nerve and giving that gliding motion to it. As you do that glide with the nerve, so moving your foot up and down or your whole lower leg, depending on where you're at, anywhere that nerve is going sort of around bones, between muscles, it can start to free it up. Anywhere it's getting pressure applied to it, it can help take that pressure away. Again, as you're doing these exercises, you're looking for that pain, numbness, tingling sensation to work its way further up your leg. If any of this is putting pain further down your leg, stop. This exercise is not for you. If you can do those exercises and they're easy, they didn't change, but they're a piece of cake for you, the next level that we add to that, depending on where you're at, is in a sitting position. What we want to do is put our head down while our foot is down. Then as you raise your foot up in front of you, your head is going to look up to the ceiling. And then your foot comes down and your head comes down. Nice and easy like that. I'm just going to show you that one again from the side. So the way we could, a progression to the flossing exercise is to do it while sitting. So when we sit, our head will be facing down towards our toes while our feet hang down. Then as you raise your leg up, your head looks up to the ceiling. And then as your foot comes down, your head comes down. So again, up and down. They move together, and that's going to take that nerve and glide it for us. So whichever of those gliding exercises you find works best for you, we can do about 10 to 15 repetitions or spend 2 to 3 minutes doing that. Again, pain-free ranges, looking for that pain to come out of the leg. That's a great way to start taking some of those symptoms, have them lower down, get some irritation off the nerve. Okay, so the next exercise we're going to do is something that's really good at decompressing our lower back and taking pressure from around the disc, around the joint. So even if it is a stenosis or degenerative disc problem, or if it's a bulging disc or herniated disc, this position is often really helpful because it decompresses everything around the lower back and around the nerves. So what you're going to do is you're going to grab a pillow, go to the edge of a bed works really well, or another hard surface that can support your body weight. You're going to get your hip to the edge of the bed, pillow under your stomach, and support yourself on your elbows to start, and then just let your knees hang down. So your knees should be straight below your hips and just gently hanging, and you can even lean a little forward to rest, and you're going to feel a little bit of traction through your lower back. It should actually feel quite nice. What we're going to do is we're going to rest here for 30 seconds, a little more as you're comfortable. To add a little bit more to this, you can actually reach a little bit forward. It might add a little more traction for you. Again, looking for that nerve sensation to come out of your leg and give a little bit of decompression through your back. You're going to hold this as long as comfortable for you, really, but do a few repetitions of 30 seconds to a minute. You can come up on your elbows, give yourself a break, and then slowly work your way back down. Again, trying to let your knees hang, let the pillow or the edge of the bed support your weight, and that gives some nice traction through your lower back. Another thing you can do in this position, depending on the cause of your sciatic pain, especially if it's in one leg and not both, is you can experiment with shifting a little side to side. So if you reach your arms out in front of you, you can slowly reach them over to one side, and you can slowly reach them over to the other side. And what you're looking for, does one side give a little more relief of your leg symptoms? Does it make a difference? For some people it will. If it does, then work on the side that takes the symptoms out of your leg. So if for me going to my left over here gives a little bit more relief, then I'm going to hold that position with a little bit of a left lateral bend in there. So again, we're going to do this for a few repetitions of 30 seconds, spending 2 or 3 minutes just decompressing our lower back. Now, I'm going to split up the next couple exercises based on what the cause of your sciatic symptoms are. If it's a disc, we're going to start with the first couple ones I'm going to show you. If it's more of a stenosis or degenerative disc problem, you may find more relief with the second couple of exercises I'm going to show you. So you may not know. If you've seen a healthcare provider and they've told you what the cause are, you've been able to figure it out, that will help you. If you're not sure, sort of a general rule of thumb is when it's disc, they don't like sitting. So sitting in this position is often really uncomfortable, a lot of discomfort through your lower back. Often that sciatic pain is worse as there's pain being put down on that disc and it's starting to squish out a little bit. If it's more degenerative disc, if it's more arthritic, more spinal stenosis, that's often where standing up or bending backwards. So if you were to stand up and do this kind of thing, it can be quite uncomfortable, whereas this is often very relieving. So discs don't like bending forward, whereas degenerative disc and stenosis, they tend to prefer that lean forward. So that's a general clue that you can go by if you're really not sure your cause of sciatic. So let's start with disc issues and what we can do there. So when the problem is due to a bulging or herniated disc, what is often happening is, I'll bring this up and show you, as there's pressure coming down on the disc, so we have our two vertebrae with the disc in between, and then we have our nerve roots here, and this is where the sciatic nerve starts in the spine. So if there's pressure on the disc and it starts to bulge out, I don't know if you can see that there, starts to put pressure on that nerve, then that nerve is going to give you that pain going down your leg. So when we sit or we bend forward, that's putting pressure on the front of the vertebrae, which then tends to make that disc bulge out the back and create our sciatic symptoms or make them worse. So in this case, what we're actually looking to do is get out of flex postures and get into more of an extended posture where the pressure comes on the back of the vertebrae and hopefully push that disc material back inside or back towards the front of the spine and not on the nerve. So the most common way we start with getting extension in our back is to lay on our stomach. So if you have a disc, this position will often be comfortable for you. You get your elbows under your chest, and we might just start by relaxing here for a couple minutes with just pressure on our elbows and mild extension in our back. Then from here, what we have patients do is start by lifting your head up, see how that feels. If that feels good, or especially if it takes pain out of your leg, you can slowly extend up, keeping your hips on the table, and you can hold this for a few seconds and then come back down. Then we'll come up again as far as you comfortably can go with making sure pain is coming out of your leg and not getting worse going down your leg. And again, hold that for a few seconds. And you can spend a couple of minutes doing this very easily, and you can hold at your tolerance. We always start with a couple seconds, and you can hold a little bit longer as you feel more comfortable. So really simple exercise, but for a lot of people, it's great at getting the pressure off of that nerve, pushing that disc forward, and getting the pain out of our leg. So that first stretch laying on your stomach for disc, we call a cobra stretch or a prone extension. The next one we're going to do is what I call a sideways cobra or a doorway stretch. What you're going to do is stand in a doorway with your feet, let's say starting about 6 inches away from the door, and you're going to lean on your shoulder. Okay, with my shoulder resting on the door frame, try and bring my feet together. I'm going to let my hips drop towards the door frame and feel that nice stretch through my lower back. Okay, hold that for a few seconds. You can come back up. Just rest on your shoulder, again, letting your hips drop. Typically for most people, if you have one-sided sciatic or that sciatic pain down one leg, you're going to put your leg that is symptom-free or the non-painful leg towards the door frame. So we're going to come here and we're going to gradually let our hips drop towards the door frame hold for a few seconds, and come back up. Okay? If that doesn't give you relief, you can try the other side, but the majority of people, your non-painful side towards the door is typically going to be relieving. To make this a little more challenging, I'm going to give you a little bit more stretch to your lower back. You can move your feet further away from the door and then lean on your shoulder here, and that'll give more room for your hip to drop towards the door and give you a bigger stretch to that lower back and potentially take some more pressure off of that nerve. As always, look for that pressure coming out of your leg or those symptoms coming out of your leg. If the exercise puts pain down your leg, stop and try one of the other exercises. So with both of those exercises, the cobra stretch and the side cobra, the doorway stretch, you're gonna hold those for 3 to 5 seconds at a time, gradually increasing time as tolerable for you, making sure symptoms are coming out of your leg. And again, you're gonna spend a couple of minutes working on those exercises. Those exercises are great and often really helpful if that disc bulge or disc herniation is your problem. But what about if your problem is more degenerative stenosis type problem? Well, you're probably not going to find those particular exercises helpful because they're going to put more pressure on the irritated part of the spine and irritate the nerve a little bit more. So if you find that you feel better when you're sitting, you feel better when you're bending forward, and extension is worse, probably those exercises aren't the best for you, and we're like exercises that open our lower back up. So the easiest and simplest to do is what we call the child's pose stretch. So to do our child's pose stretch that we often find good for stenosis type problems, you're going to start by on your bed, on the floor, wherever's comfortable for you, and you're going to get into this all fours position. From this position, hands under your shoulders, knees under your hips, you're going to let your hips sink back onto your feet, and then gradually let your head come down, your hands go forward. And then as you're in this position, you want to try and let your lower back just relax, and this should give you a really nice stretch through your lower back and often feel really comfortable. So you can hold this, start with a few seconds, 5 seconds, and gradually work up to 10, 15, 20 seconds. Hold that for a bit, come up, give yourself a break, and then again, you go down, hold for another 10, 20 seconds again. So what we've gone through so far are things to give you some symptomatic relief from the discomfort of your sciatic pain. What you always want to do is take pressure off of that nerve, and as I've mentioned numerous times in this video, you want to do exercises that bring the pain out of the leg up towards the lower back. If what you're doing is putting more pain down your leg, wrong exercise. Start with looking at a different angle, or if you're still having trouble, get it assessed by your local healthcare practitioner. Now that we've shown you some things to give you some relief, which for a lot of you watch this is probably your main goal, we also want to look at things that can sort of help you now, but also help you down the road. And the biggest thing for that is strengthening of our core. So that's our abs, our low back, and our glutes. There's lots of different exercises to do this, but I'm going to show you a couple ones that I find relatively easy to do and very, very effective. So I'm just going to go through a couple simple ones here for you. We're going to start with back in our cat camel exercise that we showed you at the beginning of this video, because I do like that for the start of any core exercise program. So again, knees under hips, hands under shoulders, head straight forward, and you're going to slowly roll your back up, and you're going to bring your back down. I always like 10 to 15 repetitions of this just to get our back loose and moving, whether we're going to be doing our stretching and our relief exercises like I showed you, or we're going to look at core strengthening. Once you've done a couple of those cat camels to get everything loosened up, you're going to stay in that same position, and you're going to do what we call a bird dog. So, hands under shoulder, knees under hips. You want your back to stay nice and flat, and what you're going to do is take your opposite arm and opposite leg, and you're just going to reach them out. So neutral position, opposite arm, opposite leg, they're reaching straight forward, okay? While you're doing this, you want to maintain a nice, strong, tight core. You're going to bring them back down, opposite arm, opposite leg again, straight in. You're going to hold for a couple seconds at the end of each repetition. So again, head neutral, belly button drawn up, opposite arm, opposite leg, and you're reaching more out than you are up. So again, we reach out. You're not worried about height, you're more about reaching out and holding your stomach nice and tight. So you can work up to 8 to 10 to 12 repetitions per side there, just to get those. That's going to start firing those little stabilizing muscles that really support our spine in around where that sciatic nerve starts. The next one that I always like is starting laying on your back, and we call this a bridge. So really easy, back nice and flat on the ground, feet flat on the table, knees bent, arms at your side, and all you're going to do is thinking about bringing your belt buckle or your belly button straight to the ceiling. So from here, up, again, you're going to hold for a few seconds and come back down. Nice and relaxed. We're going to come up and hold. And again, depending on the cause of your sciatic, if it is a stenosis type problem, you might find if you get too high that aggravates the pain. If it does, don't force it too high. Just come to where you're comfortable and back down. And as you get stronger with this, as your core and your glutes get stronger, then you can start doing one-legged bridges. So from this position, we're going to put one leg straight out, and you can use the other leg just to lift up and back down. So that's a progression you can work towards. Again, depending on what stage of recovery and healing you're at, 10 to 15 repetitions of that, ideally twice a day for all these exercises is great. That's going to start building some core strength. The last exercise I'm going to show you for core strengthening is what we call a dead bug exercise. So from our back, we want to bring our feet up, arms up, and all you're going to do is opposite arm, opposite leg, go back, reach straight out, come back up. Opposite arm, opposite leg, go out, come back up. That exercise for some people can be a little more challenging, so only work towards that one if you feel that you're strong enough and you're capable and that it's not aggravating any pain for you. But in the long run, getting your core strong, regardless of the cause of your sciatica, is going to help. It's going to help it heal, and it's also going to help prevent it from coming back. Okay, so we covered a lot of stuff regarding sciatic exercises and pain relief there. And as I said at the beginning of this video, sciatica sucks. It's really uncomfortable, it can be really limiting, and have a huge impact on your life. So by doing these exercises, you can get quick relief of your symptoms and build towards doing the exercise that give you long-lasting relief so that pain doesn't return. The way I always like to do it, loosen up those tissues around the sciatic nerve first, then work on your gliding and flossing exercises, then move towards either your extensions or your flexion-based exercises, depending on the cause of your sciatic nerve, discs versus degenerative or stenosis type problem. And lastly, as you're getting relief, work towards that core strength and stability. That's what's going to give you a lot of prevention, short-term, but as well as long-term, and prevent the sciatic symptoms from coming back. I certainly hope you found this really helpful. I've seen these exercises help countless people. I'm sure they're going to be beneficial for you as well. Please feel free to give this video a like, subscribe to our channel, as all our practitioners put videos out on a weekly basis, and leave us a comment. We love to hear questions, we love to hear comments about our videos, and even if there's certain things that you want us to put out for you or other topics you want us to cover, we'd love to hear about it. Hope you have an awesome day.